Hey guys, it's Laura again, and I'm still in Pittsburgh, as you can tell. I leave tomorrow morning, and so next week, hopefully we'll have new videos from, let's see, where am I next week? I think next week I'm home, so from beautiful San Diego, California. In this video, I wanted to talk about social media and my thoughts on what you should do for social media for your practice. It kind of goes in line with the reason I thought about this. It wasn't an actual question, it's just a topic that came to mind when I was talking about newsletters. And I thought the same thing applies to social media. There are great companies out there that you can get help with all this that know a lot more about marketing than I do. I'm just going to give you my 2 cents on what and why you should be posting to social media. Now, I personally, and I know I'll have some marketing people who will get mad at me about this, I don't think that social media is necessarily going to get you a ton of more new patients. I mean, I understand if patients check in, if they do a review for you, if they share pictures, then the people who follow them, who are connected with them, it's almost like a testimonial to your practice. So in that case, yeah, you might get new patients, but that's not my reason for suggesting that offices do social media. That's a bonus, of course, if you do get patients from it. But my reason is, much like when I talked about it in the newsletters, is that our patients don't see us sometimes for 6 months between their appointments. And they don't think about us during that 6 months. It's not like they're like, I wonder what's going on in my dental office. I wonder how my dentist, my hygienist is doing, right? They're not thinking about us. So we need to put things in front of them to remind them that they love us and that we're a cool office, and remind them why they chose us. And maybe they'll go out and tell their family and friends if they see things about us. So I think social media is a way that you can stay connected with your patients even when they're not in the practice. So I think that you should be posting regularly things on your social media feeds, whichever ones that you have. And you really need to target your patient group. So, do you have more children? That's more Instagram. If you've got older clients, people like me, it's Facebook. It's probably both. Do you need Twitter? All of that. That kind of depends on your patient base and where you want to reach. But then you want to make sure that you're posting regularly and it's not all clinical. Patients they're going to unfollow you in a second if you're putting just clinical stuff out. So you need a balance. And I think I've heard it's like 80-20 is what I've heard. And maybe someone would say differently, but I would say 80% social, 20% clinical, 20% about procedures or education or something like that. So 80% social, meaning fun stuff, highlight one of your employees and talk about who your new employee is and a little bit about them. Show pictures in the practice with your team, I don't know, having a lunch together, or maybe you dressed up for Halloween, or you decorated your office for the holidays. Like, show those things. Show your doctor, being real. Show your team being real. So many times they think of us in like scrubs and jackets, and they're afraid of us when they're in the office, but on social media they want to see the real people that work for you. So show your personality. Make sure it's appropriate. Don't show things like, don't show your team out drinking. If you have like a picnic with your team together, make sure that everybody looks presentable in the pictures that you post, because this does represent your practice. But show things that patients would be interested in seeing and want to see. And then 20% of clinical things, and in that could be maybe new procedures, much like I said in the newsletter, maybe new procedures that you do, maybe a case that you did that you want to highlight. Of course, get the patient approval for these things that you want to highlight so that you can get more people can see your work and want more. Maybe they want a procedure like that. Maybe you're offering new service like sleep apnea. Maybe you're doing Invisalign. Maybe you have an Invisalign day. Education. Maybe you want to educate your patients on some procedure or home care or something like that. But just make sure that it's not too much of that, because people don't want to see that. It is social media for a reason. They want to see the social side of it. So my advice, my gut feeling is that you post 3-4 times a week. I wouldn't post every day. But I also wouldn't post like once a month, because most of the stuff we post doesn't get seen by everybody all the time. So you want to make sure that it's regular. So I would say 3 or 4 times a week is probably good. Maybe you want to make Monday or Tuesday your education day, and then, Tuesday through Friday, your fun stuff. I don't know, make a calendar like that. The other thing is use the companies that are out there to help you if you need it. If you don't have somebody on your team that's thinking social minded like that, then get companies to help you. But make sure that it's your stuff, like it's pictures of your team and it's content you give them. They can only do so much without you guys feeding them the pictures and the stories and the things that you guys are doing. So if you are going to work with a company to help you with this, make sure that you're giving them enough content, because otherwise they're just going to have to post, hey, it's National Toothbrush Day, and patients don't really care about that. They want to see stuff about your practice. So there's my 2 cents on social media. Follow me, speaking about that on social media. Front Office Rocks. We're on Facebook, we're on Instagram, we're on Twitter. As you know, I'm on YouTube, so subscribe here. You can get ideas and suggestions from us all the time on things that you can use in your practice. So make sure you follow us on social media, and then tell your patients to do it too. Have your team talk to your patients and say, hey, did you know we have a Facebook page, and we're always posting things there. You should like us on Facebook, and let your patients know that you guys are there, and it's a great way to get connected. So thanks, guys. I think this is my last one from Pittsburgh, so I will see you guys the next time I've got a question that needs to be answered or a topic that I want to talk about. So make sure you write comments below and let me know what we should be talking about next. Thanks, guys.